5-year-old female client presenting to the mental health clinic. These are all bad with complaint of 3 months history of what? Weight loss, no, weight gain, generalized weakness, fatigue, loss of pleasure in sporting activity, which she used to enjoy in the past. She has not had sex for 3 months. This is unusual for her. She reports no desire to leave. She feels hopelessness. And then she denied any suicide thought. She sleeps like 10 hours a day. No pressure speech. Whenever you see no, it's what we call review of system. You're using it to rule out other pathologies. Hallucination, no. Bizarre behavior, no. No history of trauma, no. No recent stresses. So you rule out other history. All past medical history negative. Family history is not contributing. Vitals normal. Exams is flat affect. So you can see this patient has what? Weight gain issue. She has sleeping issue. She has interest and hopelessness. Okay. She does not have suicide so far. And then she feel weak. Okay. And lost pressure in things that she do. All this is consistent with what we call SIGICAP. This is the diagnosis of depression. She's made multiple symptoms for over 3 months. So we have a depressive patient, and we make the diagnosis and rule out other pathologies. Now, what is left? We'll answer the question they ask you. Don't worry about it. We got it. So, what is the question they want me to answer? Drag 2 actions and 2 factors the nurse should monitor based on the primary diagnosis. We know what is our primary diagnosis. It's no bipolar because there's no pressure speech. Schizoid, there's no bizarre behavior. Schizophrenia, there's no hallucination. Acute stress, she has never had any trauma. Therefore, what is left is depression. We drag it here. And when somebody is depressed, assess for suicide. Okay? It's okay to get thyroid function to rule out and make sure there's no thyroid problem, but this has been going on for 3 months. It's not an issue. Group therapy is not initial therapy. Usually you do individual therapy before group therapy. So you can treat them with medication, sexual. Okay, what do you monitor for? The first 2 weeks, they will be suicidal. So you got to monitor them as OC. You don't need to monitor their maniac episode because they are not bipolar. You should monitor for medication side effect. There's no need for hallucination. And you see, this is a bow type like question. You make the diagnosis, action, your plan, what you do, plan of care, and what do you monitor for. Straightforward. You don't need to panic. Adapt NCLEX got you. This is easy. You guys all will be fine. If you have questions, email Adapt NCLEX or join us on Zoom and do these small questions. You'll be comfortable. Take care of yourself and have a good day.